Our Laura Windsor has a report on kids and obesity.
Roger, childhood obesity has more than tripled in the past 30 years and has both immediate and long-term effects on their health and well-being. We asked registered dietitian Susan Latham of Children's Hospital of Orange County about this growing epidemic and what parents need to do to help their children on the road to health.
Statistics would say that there's about 18% of children and adolescents in the country that are defined as obese. And the definition of obesity is where the child's weight versus height is plotted on a growth chart. And if they excel or exceed 95th percentile, then that's considered overweight or obese. The long-term effects are just poor health. We're seeing a lot of type 2 diabetes in children. It used to be years ago that we would really only see that disease in people over 40. But we're seeing it, even the beginnings of it, in preschoolers. And that's a scary thing. Type 2 diabetes often turns into type 1 diabetes, insulin dependent, and that's a serious, serious health problem. First of all, families, I think, need to realize it is a problem. And they need to look at themselves as well. The parents really need to evaluate what it is they're teaching their kids or the lifestyle that the children have grown up in. So really examining the diet and what's being consumed. Are they going out to fast food all the time? Are they, not eating a lot of fruits and vegetables? Depending more on snack kind of foods. And then also the activity. If children, again, are not getting out and playing or not doing exercise or sports, things like that, that really is a big contributor. Parents really do need to understand the significance of the problem, and they need to understand that they can do something about it. As far as looking at what the children are eating or drinking, just taking out sodas or taking out fruit juice can be a huge change. Just that alone can make a big difference. Increasing fruits and vegetables in their diet. The new My Plate, which is the USDA kind of education now on the way we should be eating, shows that we really need to be eating half of the plate fruits and vegetables, cutting back on the carbohydrates, the potatoes, the rice, the pasta, and moderate portions of protein. And then not allowing the children to be sitting in front of a television or a video game or their computers for hours on end, and getting them out to do something that they enjoy doing that's physical activity. American Academy of Pediatrics recommends at least 60 minutes a day for children to do some kind of physical activity. It's difficult to change eating habits if you're really used to eating a certain way, or maybe the family eats that way. So it really has to be a family change initiated by the parents. You want to make sure that you have foods available that are easy, that are attractive, that are good, that the kids, when they are hungry, that can be incorporated in what they're eating when they're really hungry. Fruits, vegetables, healthier kinds of snacks.
As a parent, it's our responsibility to keep our children healthy and thriving, so starting good eating habits when they're young will ensure them to become healthy adults. I'm Laura Windsor for the American Health Journal.